everyone. Today we're going to be talking about terpenes and how they interact with cannabis therapies. I will start off with some introductions. I'll start with myself and then pass it on to the rest of the panelists. My name is Tamar Wise. I am the owner of Wise Science Consulting, a botanical science consulting firm. I've been in the industry for about 11 years, and I specialize in product formulation and development, as well as infusions. And then I will pass this on to Wendy.
Hi, everyone. I'm Wendy Pagwan. I'm a registered nurse, a certified aromatherapist, cannabis educator, and owner of a topical company called Clean Coconut. And is that all I'm supposed to say?
We'll just start with some basic intros, and then we'll move on to our first topic.
Greetings, everyone. Well, can you hear me? Yeah, there we go. My name is Susan Trapp, and I'm part of a couple of startups. One called Endocin, which is trying to harness your own internal endocannabinoids. Also another company called Terpenes. We're trying to collate information on terpenes. And thirdly, another company called TrialScribe that's a platform for data aggregation and analytics in the cannabis industry. And I have a background. I actually studied terpenes way before they were of interest in the cannabis industry for my PhD and my postdoc, having nothing to do with cannabis and actually nothing to do with extraction. So my area of expertise is molecular biology and the evolution of natural products using terpenes as a model.
Hi, I'm Jake Black, and I'm the CEO at Treehouse, where we focus on kind of two different divisions. One is in the wholesale manufacturing of different hemp-derived ingredients, so CBD, THCA-free extracts, and different cannabinoids. And then on the other side of the company, we have an R&D team really focused on isolating and accessing the rarer cannabinoids, so CBG, CBC, and beyond. And I come at this kind of from a maybe a more organic chemistry perspective, so hopefully a different perspective there as well.
Afternoon, everyone. My name is Stephen Goldman. I'm the laboratory director of a cannabis and hemp testing facility located here in Denver that's called Phytotech. We've been around since the recreational market was legalized here in Colorado, and have been lucky enough to test about 130,000 different samples. So definitely starting to build our database and see a lot of terpene strain correlations and trying to tie that to new formulations as well.
Thank you very much. Okay, we have quite a bit to cover today. As the synopsis said, and Susan mentioned, terpenes until recently were not really focused on in cannabis extractions, and that kind of interest has exploded in the last few years. So we can start with some basics. What are terpenes? Where are they usually found? And what are they used for in nature? So we can start with you, Wendy.
Terpenes are found in plants, vegetables, insects. They exude aromas from those plants and vegetables and insects. And they are meant to protect the plant. They're a plant protector. I guess that's the most simplistic way to put it. I think.
Okay. Yeah. Did you want to elaborate a bit, Susan? Okay.
In the academic industry of talking about terpenes, almost the first sentence in every paper that I've ever read has been terpenes are the largest class of natural products in plants and in nature. So they're a very diverse group of compounds that you see everywhere. And the way I like to describe them to people is that they're essentially, in a way, the immune system of plants. They're there, just like Wendy said, to protect, but they do all kinds of things as well. And the last thing I'll say is that terpenes in general are what we call secondary metabolites, which means that they're not necessary or essential for life. And other type of metabolites, for example, amino acids or whatnot, they're essential for life. And so that's part of the reason that this class of compounds is so diverse.
Thank you. And as we all know, terpenes are found in cannabis as well, but usually in smaller amounts than some of these other plants. And actually, Stephen and I were just talking about some of these terpenes, and when they're tested for, they show up as not detectable. Stephen, did you want to elaborate a bit on maybe typical concentrations that you find in some of the strains that you test?
Sure. There was, there's a lot of lab competition. So a couple of years ago, there was, if you will, an arms race in how many terpenes each lab was trying to measure. Some labs validating 30, 40, 50, 60 different terpenes. And then they would go ahead and report to their clients, 50 as non-detect. So I think typically concentration ranges are from half to 3 or 4% on the upper end. We've seen some selective breeding that can, definitely breach that ceiling. But typically there's 5 to 7 terpenes that are in every single plant that we see in different ratios, and then minor terpenoids making up the difference. But I think a really, really helpful way of thinking about terpenes, one that Susan already mentioned, is associating them with a plant's immune system. In a lot of ways, plants have immune systems that are, a little bit more elegant than our own. And many of us have been in grows where we see powdery mildew on rows and rows, and then nothing on a middle row, and then continuing down. And when we test that, truly the only difference strain to strain is the terpene profile. So it's a really elegant way that the plants have evolved. And what we see is it's not really, at least in the concentration ranges that could be therapeutic in the entourage effect, it's not that many. It's just a handful that these plants are using to exert that effect.
Sure. So the natural concentration of terpenes, but your lab also tests final products as well, where terpenes are added back in.
Correct.
Okay.
Both.
So obviously, because the terpene levels in cannabis are not, as high in all strains, what we're seeing is a lot of formulations that add back in exogenous terpenes, so from other plants. An obvious one is citrus for limonene. So we can move into, so terpenes, as we've heard, act as chemical messengers for the plant, but they also have an effect on the human physiological system. So we'll switch gears a bit and talk about are terpenes medically active, and what kind of evidence shows this. So we can start over on the other there with you, Stephen.
Sure. Back to back. I think there's no doubt that they're medically active. If you read the literature and see animal studies, the dose at which they're medically active is incredibly high. Tens to hundreds of milligrams per kilogram in animal and mice studies. That's a dose that's much, much higher than the plants are ever going to be able to produce. So are the terpenes in cannabis by themselves at those concentrations exerting a medical effect? The answer is no. But in combination with other ingredients that the plant is producing, do they exert a medical effect? I think it's pretty clear that the answer is yes.
I kind of have two separate points on this, but related to that and kind of the immune system talk about the plant, and then the other molecules the plant makes that have medicinal effects. You can kind of think of plants don't really, they can't run around and run away from predators and stuff. And so in that immune system or defense against the environment, they can make molecules. And so with terpenes or cannabinoids, they can evolve those random metabolites that have effects on the neurosystems of, say, insects or mammals and stuff like that. And so that's kind of the root of where it comes. And so, if a terpene or a cannabinoid is, messing with an ant that's trying to eat the cannabis, that same amount is not nearly going to have the medicinal effect on a human being by any means. And then kind of getting to a little bit more of the regulatory side, terpenes have been commonly used for flavorings and scents for, 50, maybe even more years. And there's been a big push from food manufacturers to say that they have no medical benefits at all. There's nothing, so they're generally recognized as safe, so that they can add them to foods without having to prove or their medicinal or toxicological effects. And so that's kind of an interesting thing, because cannabis wants to claim some of these medicinal effects, but there's been so much effort to claim that there are no medicinal effects, so they can go into foods and your average over-the-counter products without regulation. So that's kind of an aside, but related to the medicinal effects.
Thank you. Did you want to add anything, Susan?
Just a little bit. In general, I think if you look at the literature, it is obvious that terpenes for health and wellness have effects, not only if you ingest them or put them on as some kind of a topical, right, but in aromatherapy, for example. And there are some beginning studies out there to demonstrate that, for example, something like citrus helps energize. And I don't have the paper for this, but the reality is the whole clothing industry knows this, and they use aromatherapy like citrus, right, to make you happy, and it makes you buy. Right, so at one level, health and wellness, and all of this actually still needs to be studied in much more depth. But then again, also in terms of the medical benefit, there are obviously medical benefits, but the data in general in the past, like Jake has said, is really been focused on the cosmetic, perfumery, peppermint industry for things that weren't ingestible and really weren't necessarily for wellness. And so, again, just like the cannabis CBD industry, this is new and needs much more research.
Thank you. And yeah, so as you all have mentioned, there's really not a lot of guidelines or regulations concerning product formulation with these terpenes. So one of the questions that I had was, what kind of ailment-focused terpene-augmented cannabinoid products are we seeing on the market? How do the terpenes affect a patient's experience with their typical cannabis therapies? And how do terpenes affect cannabinoids' ensemble effect? So Wendy, we can start on this end.
I think we're seeing terpenes in just about any kind of infused product today, whether it's topical, ingestible, you have it. I mean, anything in smokable form, already has the terpenes in it naturally. And coming from my aromatherapy background, when I'm guiding a patient in the arena of cannabis, and especially if they're going into a dispensary, my recommendation is, especially if you're going after flower, is smelling the flower, because your nose knows, I guess. You'll be able to feel and experience and know if it smells awful, that's not something you want to smoke. But you can go to the next flower and you'll feel like it's a very aromatic scent, and that's something that you're gravitating to. Your body is saying to you, you like those terpenes, your body probably needs those terpenes, so go towards that scent. But your nose can change in 6 months from now. So those terpenes that you're smelling have background medicinal effects that can enhance your experience. So limonene, if you're an anxiety type person, limonene might be something good to uplift you. If you need to calm down, something with a little bit more linalool in it will help you calm down. So if we can start educating the community, you can really start to customize your medicine by understanding and knowing what terpenes are and how to adjust your medicine in that way.
Sure, thank you. And Susan, I think you speak about precision medicine and kind of personalized medicine. If you wanted to touch upon that and how terpenes fit into that.
That's a big black box at the moment. I am big on precision and personalized medicine in general for CBD, THC, and in this whole field. And terpenes are obviously going to play a part in that. Reason being is we all have, I'm sure you guys have all heard of the endocannabinoid system, right? So we have receptors in our body for endocannabinoids, and cannabis, CBD and THC, those are cannabinoids, and they're compounds that bind to these receptors. And the terpenes also play a role on these receptors. Sometimes they bind somewhere else and inactivate the enzyme. And so my point here, without getting into too much detail, and maybe there's some comments over here, is that precision medicine is complicated, but it's going to be dependent on what you're trying to treat, right? So one size is not going to fit all for CBD, THC, and or the terpenes. It really is dependent on what kind of ailment you have.
Sure, thank you. Jake or Stephen, if you had anything to add about the kind of products we're seeing, maybe Stephen, if you wanted to elaborate on some of the concentrations that you've seen in some of these products as well.
Well, like Stephen mentioned earlier, in the kind of natural extracts from cannabis, well, in the plant, maybe the terpenes are at 2 to 3, 4%. When you extract that, they go up, roughly 3 to 5 times usually. So depending on the extraction system and the processing that goes into it, you can separate the terpenes out, so there are no terpenes or very, very tiny amounts of terpenes. You can add the terpenes back in. You can leave them there at much higher concentrations, say in the 10, 15%, so 3 times as much as there was there in the plant. And so you can really start to play with a lot of these different terpenes, but also a lot of the different cannabinoids and other molecules in the plant as well, and kind of getting to the personalized medicine. It's one thing to take one individual molecule in a drug or something, say it's CBD or say it's ibuprofen. That's one molecule, right? But we just talked about 3, 4 different terpenes, and there's 7 that are commonly occurring in hemp. There's another 5 major cannabinoids that are occurring in hemp. So now you have 12 different molecules, and in each strain and in each extract, they're all at very different levels. So each one of those could have a very different effect on your body, and it becomes a terribly complicated science problem to try to piece out what individual aspect of those 14 different molecules, and there's probably 100 different other molecules that no one talks about in there as well. And so I think to kind of get to the personalized medicine, it's going to take a ton of effort to kind of go through that and sort out what's causing what effects, and in combination how they work together.
Yeah, ditto. In the pharma world, you use one molecule and you study the PK/PD, you study the metabolites, you formulate it in a specific way, you manufacture it, and the FDA approves it. Try doing that with 100 molecules, and you'll fail every time. So we're kind of doing an interesting trial right now in the public where we formulate CBD with a number of terpenes, and we name them focus or sleep, and the market decides if those products are effective or not. So we're kind of doing a large-scale clinical trial now, if you will. Those companies that have products that are effective will stay in business, and perhaps then we can study the terpene and cannabinoid formulations that they're already using on the market as a starting place for some of these drug-type molecules. But to come all the way back around, the terpene concentration is off the charts. We see concentrate products that have as high as 90% terpenes and 4 or 5% CBN. So the diversity of products on the market is incredible, and it's just accelerating every day.
Sure, and thank you for bringing that up, actually, because I absolutely agree. We kind of are in a big experiment right now, and as we all know, cannabis is one of the safest substances that we can take. Smoking cannabis with the terpenes in that plant matrix or even the extract has never killed anybody. But I wanted to shift gears and talk about the safety of these terpenes because we see safety data on aromatherapy and inhaled molecules, right? But cannabis in our industry is still one of the only, if not the only, where we can smoke our medicine. And so these vaporizers, a lot of them are not actually vaporizing, they're combusting. So what I wanted to talk about is the safety concerns, especially in light of the vape epidemic, of combusting these. I mean, when you said 90%, that's a bit alarming. Some of my formulations, these terpenes, when they're in their concentrated form, you have to use personal protective equipment. They are caustic and dangerous. So when I hear people putting them back into formulations and then combusting them, and we have absolutely no data to prove safety, it is a bit worrisome. So I wanted to pass it over to our panelists to talk about this because Cannabis we're pseudo-regulated, and as we all spoke about, terpenes are also, they're not regulated. So when we combine terpenes to cannabis, what are the safety concerns, especially for these smokables and vaporables as opposed to ingestibles or topicals? So we can start with Wendy.
I mean, I can speak more to the topical side, just because that's my thing. I do think there needs to be a cap on what we're putting in these products. I don't know what the cap is. I know as an aromatherapist, when we go through school, they tell us not to formulate beyond 10%. So I tend to formulate on the smaller side, on the lower side. And even at that point, I'm still wearing personal protective equipment. And if I weren't to do that, the room fills up with the aromas, and it's a really strong thing. So I think it's the wild, wild west right now. I do think there are some safety concerns. I think that we don't know what they are. And I think that we're starting to learn. And I think the vape crisis is going to put a little bit of light on some of it, but I don't know that it's going to be the main focus.
You're all excited.
Yeah, I got some kind of basic chemistry opinions on this, but so one thing like you mentioned, you're not really vaping a lot of these cannabis products, whereas again, I hate to give the jewel in the nicotine industry positive light, but those I think are usually water-based, and the nicotine is dissolved in the water and it does vaporize. The cannabinoids are not soluble in water at all, so you have to add some sort of oil base or terpenes to make them liquid, which then you light on fire to inhale. And I think if you kind of just use a base like the turpentine, right, the paint remover, it's roughly a mixture of terpenes that comes from nature and is 100% pure, and you would never want to inhale that in larger quantities, but you'd also never want to smoke that in large quantities. And so you can think of in a lot of these, I guess, illicit vape products is you're lighting solvents on fire if there are 90% terpenes and inhaling them directly into your lungs. So you certainly pass the medicinal threshold and go back into the toxic threshold pretty quickly, and there's no regulation on that.
It's important, I think, to think about the hardware too in the vape pens, right? Oftentimes, you can get rechangeable batteries, and sometimes those batteries have different voltages and power, and so you're going to have different temperatures that these things are volatilizing or combusting at. So now, not only are we worried about the terpenes combusting themselves, but we're worried about different temperatures, anywhere from 350 to 850. And no one has any idea what the degradation schemes are for any of those profiles. So, once again, we're in a position where there's an unlimited amount of combinations of ingredients, a huge amount of temperatures that we can use those ingredients at, and none of the data is in place to evaluate the risk for all of those things.
Absolutely. And so a limit was brought up, which I absolutely agree. But you're right. There's no regulation. There's no suggested amount. But I was wondering if you four had any thoughts on the idea of mandating that terpenes be included on product labels at a specific minimum amount, and if you did have any ideas on suggested maximum concentrations, again, specifically for combusted products.
I mean, I think the terpenes should be listed on the labels and within the percentages. Especially now, early on, we don't know what they're doing. We don't know at what percentages is a safe level and what isn't a safe level. So at this point, at least having them on labels would at least start to address and give the public the information, and they can decide, for their own personal use.
I have a thesis that I'm working on, and my thesis is more terpenes aren't necessarily better. In general, like everybody's already said here, these terpenes are in actually typically small amounts in the plant, right? And there's probably a reason for that. And so again, like you said over here, you see terpenes in less than 10%, and in cannabis it's like 1 or 2 or 3%. So there's a benefit. For example, if you have cancer, I don't know if any of you guys know this, but Taxol, tamoxifen, is a terpene. It's a diterpene, and it is one of the top cancer drugs around the world, over like, I don't know, $12 billion. And so in that particular case, you have monopharmacy, or one drug that's actually acting on these cells and doing something and killing them. But again, in general, unless you know what you're doing and you're backed by science and scientists, right? It's not a great idea to just start throwing in a bunch of terpenes for flavor. My thoughts are those terpenes, you're going to have a profile, a chemo profile for those terpenes that like in the plants or in the cannabis, there's a bunch of strains. And really the difference in these strains are the terpenes, which make them smell, or what you like about it, versus the CBD and the THC. And those are also somehow helping, I like to call it synergy instead of entourage effect, in regards to how that's affecting the patient. And so I would cap it no more than 10%, right? Unless you're doing monopharmacy or one drug per research experiment.
Yeah. Thank you. Did you want to add anything, Jake?
Just a fun chemistry fact. I like to do those. Yeah, a lot of drugs are actually made from terpenes, and there's actually half of the cannabinoids are terpenes. So the molecule is assembled by the plant by taking the terpene precursor and like linking it to another piece. And so, yeah, the terpenes can be great, and like menthol, camphor are very well known for their medicinal effect in small amounts. But yeah, so again, there's plenty of potential for monoterpenes and stuff like that. But yeah, it gets complicated.
Just to put it in perspective from an aromatherapy perspective, in your home diffuser, we recommend 10 to 15 drops of essential oil to have an effective therapeutic effect on your mood, if you're diffusing citrus or lavender or what have you. 10 drops diffusing in an entire, like 10 by 10 room is effective. So just, I do think that small is better. And, like the cannabis plant, start low, go slow. It's a very similar concept.
Absolutely, thank you. And Stephen, did you have any thoughts on max or minimum levels for terpenes in products?
Just that I have no idea what that would be, and I'm glad I'm not the regulators that have to decide that.
That's a good answer.
Yes, thank you. Okay, so it looks like we have about 10 minutes left. I wanted to open it up to questions, if anyone has any questions for our panelists. Yes.
You talked a little bit about safety as regard to combustibles, and then we talked about formulations for topicals, but what about terpenes being ingested? What kind of studies do you know? And my understanding from the aromatherapy world is that you don't want to ingest essential oils, so why would you want to ingest terpenes? Just like anything else.
Sure. That's a great question. And yeah, eating essential oils in their concentrated form versus essentially putting these oils back into formulations and products. So Wendy, maybe we can start with you as far as ingestible products and some of the doses you've seen.
Yeah, I'm not a fan of ingesting terpenes, and it's more of lack of knowledge, meaning I don't know what's going to happen. And in aromatherapy training, we were taught not to ingest essential oils, and essential oils are terpenes. And I just I think we don't know what we don't know, and I would be very cautious. And if we were to do that, it should be in very small quantities. If we were to utilize it in that manner, I mean, I know it's being put in food and things like that, and I just don't know.
Again, I'm going to start with terpenes are the largest class of natural products in plants, right? And so terpenes are everywhere. They're in your herbs. So they're in basil, they're in turmeric, they're partially celery, you name it. And so we're ingesting terpenes in small amounts all the time. And so then it goes back to, and just to put a little more, I guess, education behind this, when we talk about essential oils, essentially you're taking, let's say, celery, squeezing it, pressing it, and when you press it out and get an oil, essential oils, or basil and press that out, you have a combination of terpenes that are naturally found in that plant, just like you do with cannabis. And so we ingest them all the time in very small amounts. So again, back to the science, and it is going to be a very difficult thing to regulate, and it's also an interesting and complicated problem if you're a scientist that you kind of want to get your hands on and play with. But the reality is yeah, they probably have lots of benefits together, separately, and we do ingest them, but again, in very small amounts. So just like everybody's saying, unless you know what you're doing, and or you've got a scientist and have done some of the research. I'm kind of a conservative, traditionalist, Ayurvedic type person who wants to model what we see in nature.
And yeah, briefly, just to kind of go off that, it's the dose makes the poison, right? So, a glass of wine versus 99 proof moonshine, very different effects when you put it in your body. Same with, say, hot sauce. Like, you put a drop on, you don't pour the whole bottle of hot sauce on. And so I think that's kind of where the terpenes are at. And unfortunately, we don't know, again, like we said, we eat them every day, citral, menthol. They flavor a lot of the foods that everyone loves. But you wouldn't, just be drinking moonshine every day. That's not good for you. Everyone knows that. So.
Stephen, did you have anything else to add?
No,
Okay.
well said.
Okay. Any other questions? Sure, go ahead.
I'm not familiar with aromatherapy, but how is the efficacy measured in something that you smell? Is it clinical or is it kind of a self-assessment of the plant?
Sure. Wendy?
Yeah, I mean, it's very similar to what we see in the cannabis world. Is it's very individual, and patients would come back, over time. We do an assessment, and if something didn't work, we'd, increase or decrease a dose. We'd add or subtract something. Very much like I was saying, is I would have you smelling different essential oils and see what you were gravitating to before I, make a special blend for you.
So there's like a checklist that you
Sure.
Is there a pharmacological mechanism by which essential oils work that we know of?
Sure. Did you want to start with that one, Wendy?
There's definitely a mechanism of action. Probably depends on the essential oil themselves, and but I don't fully know. I'm not a pharmacist. Yeah.
Well, Susan, did you do one?
This is not my area of expertise, and I have a feeling you have something to say. But bottom line is it's aromatherapy. So you have receptors in your nose, your olfactory system, right? So these aromatic compounds are binding to those. Actually, beyond that, I don't know much in terms of the science behind it, but they're actually having an effect. And I'm the one who's giving a course this afternoon, so I just got a little bit current. There was a paper out that actually they created a mechanical nose to actually start to study the aromatics, right? And I haven't had the chance to read that in detail, but there's an abstract. And there's also a paper from Japan that they were studying the effects of limonene on depression. And again, I just know this from reading the abstract. I haven't read it in much detail, but they actually subjected the subjects or the patients to limonene, and there was a difference between those who had aromatherapy for a month versus those who didn't in terms of their depression. So it's coming out, right? There are some papers, but it's in its infancy.
Yeah, for sure. And the traditional pharmacological model is one molecule, one receptor, they bind, there's a downstream effect. That binding is very, very tight for CBD as well as a lot of the terpenes. They're what's known as promiscuous binders because they don't bind anything really tight, but they bind a lot of different types of receptors a little bit weakly. So, very likely that they're involved in many different processes.
Does glyphosate degrade the terpene content of a plant?
I do not know the answer. My guess would be no, in that I think with glyphosate, they put a specific gene into plants, and then the plant, and then the plant can take glyphosate, degrade it, and then all of the other weeds cannot. And so I think it's kind of ancillary, but that's a guess.
I've heard some, I guess I call them holistic health experts over the years say that amongst the damaging things that glyphosate does is it attacks a plant's ability to produce vibrant colors and to produce vibrant aromas. And the reason why I ask this question is because it's my understanding that still the vast majority of the hemp crop in the United States is still sprayed with glyphosate. So would that crop inherently then have a lower terpene count than the organic count?
I don't. You could. The best answer I'd be take glyphosate-treated hemp and non-glyphosate-treated hemp and bring it to his lab, and he could test the terpene profile. And I don't know the answer.
Oh, yes.
So you guys talk of multiple terpene compounds, 30, 40, 50, 60, 70. What are the top 10 terpenes that are found in cannabis hemp?
Almost every cannabis or hemp plant has myrcene, caryophyllene, pinene, limonene. Depending on the strain, those will go up and down.
And then the kind of those mixtures of those different terpenes are what you get as your kind of perceived aroma, right? If it has a lot more citral, it's a more citrusy smelling thing, but then your sense of smell is super complicated, and so every different ratio of those things will give you kind of a different smell in that sense. And then, again, related to the health effects, I believe mycerium has actually been listed as Prop 65 in California as a carcinogen. And I think the study that they did was dubious. They fed rats just pure mycerium, and they got, cancer or something. So I don't think that's a good data point, but it is of concern for then cannabis given the regulations in California.
So are say a terpene strain a mixture of better than terpenes that are isolated?
I would say no, but this might be an unpopular opinion. I'm a kind of classic old school chemist, and I think if you got linalool from lavender and citral from limes, and you got all of your different terpenes and you blended them identically together in the same proportion, it would be pretty similar, maybe not identical, but it would be roughly. And that's my opinion. There
Yeah,
might be
I agree with that.
Follow-up for that comment, some of the terpenes have stereoceptors.
Mhm.
So
Yeah.
given that, could you really consider botanically derived terpene or cannabis-derived terpene identical?
Again, I just wrote a paper on limonene, and it turns out that I think lemon has one, I don't know which it is, but has one enantiomer, and cannabis generally has a different, and that really lemony smell is from lemon, and cannabis is a little bit different. And so they do have different interactions. So but if the question was, like, you took cannabis and extracted terpenes from that cannabis and then put it back in, right? Then they're chemically identical from a chemical organic chemistry point of view. But if you're taking terpenes isolated from other plants, right, then there is a possibility that it's not the same stereoisomer.
Mm-hmm.
And I think if you really wanted to, you could get both stereoisomers commercially available from a different plant and perfectly do it. That would be a lot more expensive, but yeah,
Right.
versus just getting it from the plant.
No, thank you. And I think we need to wrap up, so we'll take one more question.
Kind of a simple
Sure.
question, but when you smell the aroma of a plant, cannabis plant, assuming it's not some blend, but it's just the raw plant, is 100% of that terpene, or are there other things that contribute to the scent of that, the aroma of that? Or is that just flat out all terpene?
You're smelling everything that volatilizes at room temperature, so it's most likely more than just the terpenes.
So is it like 60% terpene or like 9%? Then you just kind of
It goes back to terpene chemistry.
Yeah, unknown.
Yeah.
I don't know.
Yeah.
Do you guys have a headspace detector on your GC? Bring it to his lab and put it in his headspace detector on his GC. And
I mean, the bottom line is it's like, so when you talk about a terpene being aromatic, right, it volatilizes. So at a lower temperature, it goes into a gas phase, right, so that you can actually smell it. So what they're saying is that any other plant, any other compound in that plant that also can volatilize, right, like hexene can volatilize. Not that plants have hexene. I don't know if they do, but anything that volatilizes, you're going to smell that as well. So the aroma is probably, I'm totally making this up, I don't know, 60 to 80% terpenes, you know, right? Yeah. But you're going to have some other stuff in there that, okay, yeah. Okay, well, thank you all very much.